So this video here will discuss how to assess the lumbar spine range of motion. So during your lower back flow, essentially if the H&I was negative, meaning that there was no discrepancy, there is a limited range of motion of the lumbar spine, and we have to assess. Okay, so the four motions we're going to assess is side bending left and right, flexion and extension. So the key here is when you do this type of assessments is that the patient must be an adequate length from you. If the patient is too far away from you, you're going to bend over like this and you hurt your back. Okay, so the key here is that when you flex the person's knee, and I'm not sure you can see from the video, but the knee should be slightly off the table. That way you can use your thigh to flex the patient's hip, especially if they're very stiff. It'd be very tough to do. Okay, by flexing the hip, you start to beginning to flex the lumbar spine. Alright, and as you're doing this, you're going to palpate the interspine spaces. So here's the iliac crest. I'm going to go straight down here. That's the space between L4 and L5, and I'm just going to flex. And now I'm trying to see if it opens up. And I do that a couple of times. It's very hard to tell if it's moving well or not moving well if you have done a lot of these. So the biggest thing is you have to compare it to other segments. So I'm going to slide my hand down here and see what's going on. And keep going one segment at a time. Right? This is called passive intervertebral motion testing or PIVMs. And you go each segment and see if it could flex or not. You can also test for side bending. If I want to test for left side bending, I go to the superior part of the spinous process, right, between the two gaps there, and then I go by the ankles and pick the feet up like this, and you see that causes a side bending motion, and you should feel the two spinous processes approximate or close, and you go one segment at a time. So you're looking for hypermobilities, but you could also sometimes see a hypermobility where you see the extra little shifting type of motion, right? Like excessive motion, right? If you want to test side bending in the opposite direction, you can just drop the legs down like this and hug the pelvis and do the same thing, right? But this time you're palpating inferior to the spinous process, inferior to the spinous process, inferior to the spinous process. Okay. And then if you want to test like extension, right? Yeah, the patient has to move closer, so they can move closer, about 6 inches off the table. Okay. And then you do the exact same thing. You palpate the interspinous spaces, and you extend, and you extend, and you extend, and you see does each segment close. The key here, you flex the knee all the way. When you flex the knee all the way, you're tightening up the rectus femoris, which attaches to the front part of the pelvis here, and it helps tilt the pelvis down. So you're assessing the segment, assessing the segment, assessing the segment. Okay? So that's a good way of assessing extension PIVMs, flexion PIVMs, and side bending PIVMs. There's a way to test rotation PIVMs, which we won't cover because that's not a motion often that we have to deal with. Right? So that was PIVM assessments.